What to expect during your appointment. You can contact us a few different ways. You can refer yourself online using our website or calling our helpful admin team. You can also be referred by a healthcare professional such as your GP. Whichever way we receive your referral, we'll usually get in touch with you within the next couple of days. We will contact you either by sending you a text message with a link to an online portal to choose and book your own appointment slot at a time that is convenient to you, usually between 9 to 5 p.m. Monday to Friday. If you do not use an internet-enabled device, or if we have any questions about your referral, we will get in touch by telephone to arrange your appointment instead. Your first appointment may be telephone, a video call, or face-to-face in person. You will receive a text 2 days prior to the planned appointment, reminding you of the appointment. We want you to feel comfortable when speaking to us, so you may be asked if you need any help during the appointment and whether you would like someone to accompany you. This might be a family member, friend or carer if you welcome their involvement. You may be asked if you require an interpreter, which we can arrange for you. Before attending your appointment, you will be asked to complete some questionnaires to tell us a little bit more about your difficulties. They are important to help us understand your symptoms and progress at every appointment. These questionnaires can be completed online. You will be given a private login details in advance to do this. If you do not have access to an internet-based device, such as a smartphone or laptop, we can provide you with a paper copy of the questionnaires instead. You can then review these with your therapist at the appointment. Completing the questionnaires before the appointment means that you and your therapist have more time to discuss your current difficulties when you meet and allows your therapist to tailor the assessment more precisely to you. This can improve shared decision making about your treatment and support between you both. For appointments that take place over the telephone or video call, we ask that you make sure you have a private space for appointments where you can speak freely without interruptions. We will not be able to carry out the appointment whilst you are driving because you may be distracted and can pose a risk to yourself and others on the road. If you are driving during the appointment or are in an unsuitable public place where you cannot speak privately, we may end the call and rebook the appointment. Your appointment may take between 30 minutes and an hour. It is important that you allow enough time for the whole appointment and that you give us as much notice as possible if your availability for the appointment changes after booking. During the appointment, you will be asked several questions. We'll discuss your current symptoms and the impact of the main problem you are having with your mental health. We will discuss an overview of your previous difficulties, such as whether you have experienced difficulties before or if you have had previous therapies. We'll also discuss your safety and the safety of anyone who depends on your care. We will also ask about your goals to understand what you think might be helpful and what you may be looking for. We will also discuss the suitability of our talking therapies treatments for the main problem that you are experiencing. This means that we may speak with you about the capability, opportunity and motivation you have to use therapy sessions and complete between session work meaningfully and carefully consider your readiness for behaviour change at this time. We gather this information so that we can make a shared decision about what will be best for you and to keep you actively involved in your treatment planning. The outcome of the appointment will be to offer one of our short-term talking therapies options if you and your therapist both feel that this is suitable, or re-refer to you or signpost you to other options that might be better to suit your needs, such as other mental health services in the NHS or local support services outside of the NHS. These are the range of interventions that we offer in Barnsley Talking Therapies based on the outcome of your appointment. Throughout your time with us, we will discuss with you what confidentiality means. That is, that your information will not be shared with anyone outside of our team. We will also explain the limits to confidentiality and when this may need to be broken. This is because we have a duty of care to protect you and the public. So if you do tell us that you are unsafe or there may be a risk to yourself or others, then we may need to speak to other professionals about the concerns raised. We always aim to tell you about this wherever possible. If you would like to find out more about our service, please visit our website or scan the QR code on the screen now.